Hi, my name is Oscar Vieda. I'm a student physical therapist assistant here at IoT, and today we're going to be going over TENS. So TENS is used for more gait control theory, so to reduce pain. And then we'll go over some parameters as well. This one has 3 different settings. It has conventional, acupuncture, and burst. And then burst is just a mixture of conventional and acupuncture. But acupuncture, the pulse frequency is between 2 to 5, and then the pulse duration is 100 to 300, right? And then for the acupuncture as well, you should be feeling like a tingling sensation as well as like a twitch almost, right? Because it's also going between conventional and acupuncture. And then that one, the treatment time is typically between 20 to 45 minutes. And the pain relief with that one is associated about 5 hours of pain relief. But today what we're going to be going over mainly is the conventional setting. So first things first, you're going to go ahead and turn it on. And I already connected this wire onto it, right? Simple. Just take it off, put it back in, and that's going to be one channel that's on, right? So to turn it on, you have the little amplitude knob here, and you go ahead and flip it. You'll hear a little beep sound. Turns on, and then you can see here the settings are right there. You have set and mode, right? For mode, you want to make sure it's in normal, right? And if it's not in normal, you just alternate until it says normal, which I'll get to right now. See, normal. And then to set the parameters, right, you want to press set, and then you use the arrow keys to go up and down. And since we are using conventional, you want to make sure that the pulse duration is between 50 to 100, right? So right now it's at 80, right? And then the pulse rate is between 30 to 150, and right now it's set to 100 as well, right? So the pulse duration itself is the bandwidth, right? Just how deep it goes, right? So if it's a bigger muscle belly, you want it to be a little bit higher. If it's more superficial belly, you would go less, right? And then the pulse frequency is the surface area of the electrodes that it'll cover, right? Which are right here. Again, I connected these kind of like preset a little bit, right? Simple, connect and disconnect, right? Before you use it on a patient, you want to make sure you clean it with alcohol pads or whatever surface you're going to use for muscle, right? So once you do that and you clean the area that you're going to be using, right, it's all clean. It also takes off excess oil or any lotions that the patient may have used, and it helps the pads to stick a little more efficient, right? So we're going to go ahead and take an electrode off. And you want to put it more towards like a linear path, right? So there. Oop, wait. Let me get another alcohol pad real quick. I went a little too lower. Get the pad. Again, clean here. I'm going to use more of the elbow area, not the forearm. Right, so right here. Cool. So once that's clean, take off the electrode. All right, and you're gonna want it, stick it into like a linear path, right? So I'm gonna place it here. And then we'll go ahead and take the other electrode and we'll stick it right here. Right? And then you want the area of pain to be more towards like the center as well. All right. So once that's on there, you're gonna go ahead and come onto the knob, and then we're gonna go with the amplitude. So now with the amplitude, it's a little different for everybody, right? So this is gonna vary per patient. So you go ahead and turn the knob nice and slow, and they should be feeling like a tingling sensation, right? Nice and easy. And again, they're kind of in control of this too, right? Because it's dependent on patient by patient. What you don't want to see is muscle twitching, right? If the muscle starts twitching, it's too strong, right? So you're going to go ahead and back that down until they feel more of that tingling sensation, right? So once that's on, you go ahead and leave it on there. And then since it is conventional, they can use it for about 24 hours, but they need to take breaks in between, right? Because they also don't want to be in that euphoric state all day, because once they come off of it, it can be pretty detrimental for their own health, right? So 24 hours, breaks in between, and then the only thing too as well is that the pain relief will only be active as long as this is on. Once it's off, the pain symptoms may come back, right? And yeah, so that's TENS. That's all it is. I'm going to go ahead and turn it off. Nice and easy. Bam.